Total Physical Fitness is directed by physical therapists. Today I'm going to talk about some easy self-assessment tricks that you can do just by pushing on key parts of your body to minimize any kind of onset of tendinitis or problems. So typically when you're exercising or you're a weekend warrior or you train in martial arts or you run a lot, or even if you just kind of type a lot and work with your hands on your job, these repetitive motions and high frequency of use of these body parts can lead to tendinitis. Now, by the time you feel the pain, typically the problem has been pre-existing for a number of weeks. Now, you want to address those problems before they become painful. How do you do that? You push on the key areas of your body. So, for example, the elbow, there's a spot just on the outside of the elbow joint right here. You want to kind of dig your thumb in there. And on the inside right here, there's another hot spot. Right in the inside of the elbow, try to dig your thumb in there. In the shoulder, it's going to be right in front of the joint right here. Right, if you sort of find the very top of the joint, just kind of go down into the front of it about an inch. Just, dig a finger, kind of poke around. Right, for the knee, it's going to be typically right below the kneecap. Right here, just kind of dig your finger in there and just to the sides of it, right there. Okay, and then for the ankle, typically it's going to be like the Achilles, just where, take my shoe off, right here, right where the heel, right above the heel, just kind of digging in there. So those are all the hot spots where you can have some developing tendon inflammation. Now, a lot of times they're starting to get inflamed. You don't feel it when you're walking, when you're using your arms or your hands, or when you're running, but they're tender when you push on it. It's very common when I have patients treat, and I'm pushing on those body parts, and they'll say something along the lines, "Oh, I didn't know that was painful until you pushed on it." Well, I didn't cause any pain. It's just that there's a little bit of inflammation in there, that just not so much where you feel it daily. Now, if you start to find any hot spots and they are painful, you want to start by doing some light stretching for that area. A little bit of rest would be good. Putting some heat onto the area, for example, if it's the elbow, right? Some heat, followed by 10 minutes of heat, followed by some stretches for the elbow right here, followed by some gentle massaging just to get some blood flow to the area. A lot of times, if you already have a little bit of tenderness there, the associated muscles, right? So if it's here, it's going to be these muscles. If the hot spot's here, it's going to be these muscles. If it's the shoulder here, it's a little bit more complicated, but typically the muscles right in the front of the shoulder, you can dig in there, they're going to be tender, kind of massage that area. If it's sort of here, you're going to want to stretch your quads and work on your quads. If it's the sort of Achilles down in the heel area, you want to stretch your calf muscles. So you can repeat the procedure of like 10 minutes of moist heat if you have access to moist heat. You can use dry heat, just takes a bit longer, maybe go 15-20 minutes, followed by some stretching, holding each stretch for each body part about 30 seconds. You do 3 to 5 of those, followed by a couple of minutes of massage. If you do that early on, you can really avoid the onset of tendinitis and really avoid the need to have physical therapy, teaching you how to not come here. So if you follow the advice, it should work very well. If you actually have any body parts that you have problems with, just leave a comment and I'll answer and help you through.